Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering histrionic personality disorder. Now, histrionic personality disorder, this does fall under cluster B personality. Under the cluster B personality, you have the histrionic personality disorder and you have the narcissistic personality disorder. But for this specific video, I'm only going to cover the histrionic, but in another video coming soon, I'll cover narcissistic. If you haven't done so already, go ahead, like and subscribe. Like this video, subscribe to this channel. You know you're gonna love this video. Please be sure to engage with me in the comment section. Let me know what you thought about this video. And don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. All right, guys, so let's get started. Histrionic personality disorder. Let me make this a little bit bigger for you. So look what it says here. It says histrionic personality disorder. And that word histrionic, doesn't it remind you of like hysteria? Yeah. So a person with histrionic personality disorder, those are your drama queens or your drama majors. Take a look. People with histrionic personality disorder are excitable and dramatic, yet are often high functioning. And the thing is, when the book says high functioning, like they have a job, they have a home, they may have a vehicle, they're high functioning individual. But something you're going to learn about patients with this type of disorder, they can't keep long lasting relationships. And I don't mean only relationship on a romantic level, even friendships. And you're going to see why. Let's keep going. So they're often high functioning. They may be referred to in terms as a drama queen or drama major. Classic characteristics. Whenever you're studying, guys, and you see that word classic, highlight whatever comes after it, because that word classic lets you know most of the time, if you see this, you need to be thinking of this, okay? So classic characteristics of the person with histrionic personality disorder include extroversion. So you know how you have people who are introverts, they like to just keep to themselves, they really don't like to mingle. No, these people are the opposite. They make best friends. They're like best friends with somebody in a day. They make friends very quickly. They are people, you can't say people person. I'm a people person. They are people persons. That's not proper English, but you know what I mean. All right, that's who they are, okay? Includes extroversion, flamboyancy, colorful personalities. When they walk into a room, you know that they walked into the room. They're not coming into the room quiet, okay? They like all eyes to be on me, okay? That's who they are. Despite this bold exterior, they tend to have a limited ability to develop meaningful relationships. All of the relationships that they have are superficial. They don't have deep, long-lasting relationships. In clinical settings, it tends to be diagnosed more frequently in women than in men. The disorder is characterized, you see that word characterized, you see classic highlight, it's characterized by emotional attention-seeking behaviors. If they're in the room, they need everybody to know that they're in the room, okay? Attention-seeking behaviors, including self-centeredness. They will turn every conversation into something about them. Low frustration tolerance. That means the minute that they don't get their way, they have a very low tolerance for being frustrated or not getting their ways. They don't know how to handle it, okay? And excessive emotionality. The minute they don't get their way, the minute something goes wrong, it is the end of the world. So their reaction is out of proportion to what's happening in the situation, okay? The person with histrionic personality disorder is often impulsive. They don't think about their behavior. The minute that they feel an emotion, whether it's anger, whether it's happiness, whatever that's emotion that they feel. And by the way, when they feel emotions, those emotions are strong, either way on the spectrum. They have to act on it. They don't think about it before. I'll give you a perfect example. Do you know how many times I look in my comment section and the things that I see some people post, and I'll start replying, or I want to reply, but I'll think about it. And I say to myself, Professor D, and Professor D says, yes. And I say, that's not appropriate. Let it slide. And Professor D's like, are you sure? I think we need to check this person. I'm like, I'm sure. Okay, so you think about it. But the patients with this type of personality disorder, they're impulsive. They can't help it. Okay, they're impulsive and where was I? They're impulsive and may act flirtatiously or provocatively. Relationships do not last because the partner often feels smothered or reacts to the insensitivity of the histrionic person. That love bombing becomes a little bit too much. Or it may not be love bombing, but something just very slight, something very minute goes wrong in the relationship, and the person's acting like it's the end of the world, and they really blow it out of proportion. And after a while, that person's partner just gets fed up. The individual with histrionic personality disorder does not have insight into a personal role in breaking up relationships. It's never their fault. They cannot see how their behavior is affecting their relationships. Without therapy, they won't be able to see that, okay? Let's take a look at nursing guidelines. Nursing guidelines should reflect an understanding that seductive behavior, look at this, guys, is a response to distress. So the minute that they feel stressed over something, they feel frustrated over something, their immediate reaction is to be flirtatious or to be seductive. It's kind of like a coping mechanism for them, okay? Keep communication and interactions professional, because before you know it, you don't do that and you blur those lines, you mess around and lose your license over having an inappropriate relationship with a patient. Remember, this is a disease, this is a disorder for them. They cannot help it, but you can help yourself. Patients may exaggerate symptoms and have difficulty in functioning. Remember, they're the drama queens or the drama majors, so anything small, they may exaggerate it. Assist the patient to clarify feelings because they often have difficulty identifying them. So for example, the minute the patient's frustrated about something, they may become provocative or they may become very flirtatious, but as their nurse, help them explore this behavior. Okay, why are you really behaving like this? What is frustrating you? What is bothering you? Help them to explore it and be able to verbalize and express what they're feeling. Teach and role model assertiveness, and you have to keep clear boundaries. Assess for suicidal ideation, because remember, their reaction to things are very, very dramatic. They have a very low tolerance for frustration. So you always do have to consistently assess them for suicidal ideation. Something so small to them is the end of the world, and they may just want to end it all, okay? Look at treatment. Psychotherapy may promote clarification of their inner feelings and teach them how to appropriately express the feelings that they have. Group therapy can be useful in this type of population, but look, guys, their symptoms can be very distracting. You're trying to have group therapy, but they're blowing a gasket over something very minute, and those symptoms can be disruptive to other individuals in the group as well. Here's the thing, there is no cure, there is no medication for personality disorders, and that's across the board, whether we're talking about narcissistic, whether we're talking about paranoid, whether we're talking about histrionic. Now, if the patient has a comorbidity such as depression, then we can give them an antidepressant. If they have a comorbidity such as hallucinations or bipolar disorder, then we can give them medications, but there's no cure for the disorders, for the personality disorders itself. Okay, so psychotherapy, group therapy. Now take a look when it comes to medications. Medications such as antidepressants can be used for depressive or somatic symptoms. What does that mean when you see that word somatic? So somatic is when a patient has physical symptoms, but the underlying root, the underlying cause is psychological. So for example, I'm really worried about my child. I'm really worried about my child. And then all of a sudden I'm getting stomach aches. Is there anything wrong with my stomach? No, but it's that stress of worrying and I'm getting stomach aches or headaches or all these other type of symptoms. So it's when the patient has a physical symptom, but that underlying cause is psychological or emotional, okay? Anti-anxiety agents may be helpful in treating anxiety. And then antipsychotic agents, guys, you know, we give antipsychotic agents when the patient is experiencing psychosis, which means they are out of touch with reality. Guys, that is your histrionic personality disorder right there. Easy peasy. I know when you're in the nursing program, things seem so hard. You're reading it in the book and you don't understand it, but that's it. That is your histrionic personality disorder right there. Let me know what you thought about it. Let me know what you thought about it in the comment section. Please, if you haven't done so already, guys, support my channel. Supported by liking this video, subscribing to my channel, share my content with a friend, or share it on your social media platform. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. And you guys can catch me almost every day covering different types of questions on my other social media platforms, such as TikTok, Instagram, and Facebook. Thank you so much for watching this video, and you guys will catch me on the next video.